Fear illnesses general. One must distinguish between real, well-founded fear, the fear of illness, accidents, death, loss of a dear person, and unrealistic or exaggerated fear as it appears at the so-called fear disturbances, fear of crowds, narrow rooms, spiders etc. At these fear disturbances, which belong to the most frequent emotional illnesses, the normal feeling of anxiety of the persons affected is increased so that it leads to a strong impairment of their quality of life. The fear reactions cannot be checked or handled in their intensity and frequency anymore. They appear in actually harmless situations. The patients have, however, the conclusion that these fears are unrealistic or exaggerated partial. The therapy. People suffering from a chronic fear illness often have objectively harmless situations react in their life on one with fear symptoms like difficulty in breathing, tachycardias and dizzinesses sometime. Since they have experienced this first fear amount as a situation charging extremely, they are afraid that it could recur. They consequently try to avoid situations arousing fear potentially. So you get into the vicious circle of the fear of the fear. The body of the persons affected often already reacts at the bare thought on a certain situation with the physical fear symptoms described above. The earlier a fear disturbance is treated, the better the chances of the patient of cure are. At first, the causes of the disturbance must be analyzed in a singles or group therapy so that it gets understandable for the person affected and he can break through the vicious circle out of fear and avoidance. New behaviors are practiced in role plays or by an outline training to become the unchecked fears gentleman. In difficult cases, antidepressants or tranquilizers can in addition be used for the support of the therapeutical measures due to the high addiction danger, however only over a short time period. At the fear illnesses, one must distinguish between real and exaggerated fear. You can develop creepingly but also be indicated by panic reactions suddenly appearing. Fear illnesses influence the quality of life of the persons affected in extremely negative way. The syndrome. Fear is the normal feeling to herself, a mixture of uncertainty and strain which is caused by an entered or expected threat. It speaks by physical symptoms, increased muscle strain, palpitation of the heart, faster breathing and pulse, sweat, trembling or dizziness, since it shall enable the person affected to defend itself or to escape.